The World Health Day is celebrated every year on the 7th of April to emphasize the importance of healthy living. Now, this year, the focus is on healthy beginnings and a hopeful future. According to the World Health Organization, 1 out of 3 Nigerians suffer from high blood pressure, while more than 20 million live with various mental illnesses, many of which go untreated due to stigma and also limited access to care. Well, joining me to discuss the World Health Day today is public health specialist Cornelius Ohansi. He joins me from Abuja studio. It's good to have you join us on the news at 1. UNICEF says 40 million Nigerian women of childbearing age usually face a high burden of health challenges. And in the same breath, we have about 262,000 babies dying every year. This is the world second highest figure. What do you think we're not doing right as a nation? And why do you think this is a priority for the World Health Organization?
Thank you very much. Thanks for having me. For this year, the focus is on maternal. The focus is on maternal and child health. What the WHO is saying is that women should not die giving birth, and children should have a chance to live, because as a country, we have a very high burden. What it means for our maternal health is, for example, if there are 10 women that die from giving birth, 3 of these people are from Nigeria. And that's very high. We have high numbers for stillbirths, and also we have high numbers for infant mortality. There are a lot of things that we could do better. Talking about health investments, the present government is doing a lot. Like you have initiatives like the MAMI. A lot of investment is coming in, but we need to focus on some more priority areas like human resource for health. We are not resourcing our health effectively as we should. We seem to be concentrating more on building new centers, and those centers will run themselves. They need to be run by people. Strengthening our healthcare system in general, looking at it from a universal health coverage point of view, where primary healthcare should be the fulcrum or the focal point from which citizens, Nigerians, this time will get health. Thank you.
I mean, this is coming at a time where there is a reduction in fundings for special health needs, across the world, for health needs like HIV, infectious diseases, and also terminal illnesses. But what do you say are the most effective strategies to reduce the preventable deaths that we are seeing at this time?
Okay, back to the issue I raised. We, as a country, we're bleeding health workers. That needs to be addressed. We have to have implementable policies that care for the Nigerian health worker. And for the decreasing funding, the federal government has injected a lot of money to make up for whatever was coming in for partner or donor funding for us. I think the issue has never been about money. Most of our issues have been about those sums that are budgeted. Are they actually going into delivering what they said it should deliver? We have not been very prudent. The present administration now has what is known as SWAP, and we're hoping that through SWAP we're able to consolidate and have a centered approach and a human-centered approach to healthcare delivery in Nigeria.
I hear you. But, some persons will also take you up on what you have said, saying that possibly money is not an issue. Healthcare financing, I would say, is still a big issue at this time. The cost of care for most persons is usually high, especially for rural and underserved communities. But how do we bridge this gap and ensure that some of this, amounts that have been disbursed are utilized in the proper way?
So that's these conversations are going on nationally. That's the reason, one of the reasons why we have SWAP. So there's some form of consolidated approach to health financing in country. And it's why what I meant that I didn't mean that we didn't have issues around financing. I just meant that most times the money is allocated for these projects, are they actually going into delivering those particular projects? So not until we are able to actually properly monitor and evaluate funds coming in country or those budgeted, because the partners didn't just cut funds immediately. They have been telling us we're supposed to have strategies to sustain whatever began. They just closed the taps. So I think right now it's back to government. We're supposed to have dug our wells long ago. Do we have the wells running? So if I've learned anything from COVID, I think we need to build back.
All right. Thank you for talking to us. Public health specialist Cornelius Ohansi. Thank you for talking to us at this time.